is Caroline van Heugten and I'm a professor of clinical neuropsychology here at Maastricht University. I work in two faculties, Faculty of Psychology and Neuroscience and the Faculty of Health, Medicine and Life Sciences. And that is important because we neuropsychologists study the relationship between brain and behavior. So we are both working in a medical as well as in a psychological context. My field of expertise is the consequences of a brain injury, such as due to a disease, a stroke, for instance, or due to a fall or an accident, such as a traumatic brain injury. We do research to the consequences of brain injury, and we do that within the Limburg Brain Injury Center, which we founded about 5 years ago. And the mission of our center is to optimize or to increase the quality of life of patients with brain injury and their family members. Within the Limburg Brain Injury Center we have 4 activities. So we do research, we do education, we do healthcare innovation and societal activities. Now, as you can imagine, a university is dedicated to research and education. For me, it's very easy to combine my role as professor in our own center. The idea of the research center is to be more societally relevant. So we do not only do research and education within the university, but we collaborate with all relevant parties in the province of Limburg. So all hospitals, all 6 hospital locations, also the patient organizations and other healthcare providers in the area of brain injury, such as Adelante Rehabilitation. We have exciting times over the last decades because there is much more known about the brain and the functioning of the brain. This is mostly due to the innovations in technology, such as neuroimaging of the brain, which leads to new exciting research areas also for us as psychologists. So on the one hand, we know more about the functioning of the brain and we try to repair when the brain is damaged. But on the other hand, we know that repair of brain damage is pretty limited, so people will still have to live with the consequences of a brain injury, and there we as psychologists are very important to help people get acquainted to a changed life due to their brain injury. Actually, we don't have results yet, so that's kind of a deal breaker, but I can tell you something about this research, because what we are interested in is to what extent does the coronavirus lead to brain damage, because we just don't know. It's a new disease and we think that it's mostly the people who were very seriously infected and were admitted to the ICU units of the hospital are the ones that may have brain damage. But from research in other countries and also across the Netherlands, we already know that the damage to the brain is probably limited. So if people have brain damage, it's mostly caused by the fact that they were seriously infected and they had a critical illness for which they were on the intensive care unit. But probably it is not specific to the coronavirus and what that does to the brain. But you'll have to follow us because our research results will be coming soon. I moved to Maastricht already about 25 years ago, and I came from the west part of the Netherlands. I studied at Leiden University and did my PhD at Groningen University, and then I just applied for a job here in the south, and I never left because I really like working and living here. So for me, working here is exciting because of the combination of medicine, life sciences and psychology. So all 3 areas are important for my work, and we are all together here on the campus, so that is very exciting. I have a lot of colleagues close by to collaborate with, which increase the quality of our research. And living in Maastricht is for me very important because we're very close to other countries. We do shopping in the area in Belgium or Germany in the weekend, and I'm an outdoor person, really liking good food and drinks. So I'm always outside, hiking and biking, combining that with eating in a good restaurant. So you shouldn't miss Maastricht.